You know how confusing it can be when people come to the clinic with multiple aches and pains? It can be hard to figure out what's going on. What you need is an approach, and today we're going to give that to you. Let's go.
All right, we're moving.
Now, we're going to do musculoskeletal differential diagnosis. And this is going to be a little different than what you see in the sports medicine clinic, when you know there's macro trauma or micro trauma to a particular area, and you just have to figure out, is it bone, ligament, joint, what's really the problem, and go from there. We're talking about when people have more chronic, multifocal aches and pains, and this can be really complicated. Sometimes they're interconnected, sometimes they're separate. How do you figure out what's going on without just throwing a bunch of pills? Because non-steroidals are very toxic. Prednisone is very toxic. You need a targeted approach, and today we're going to give that to you. We're going to do musculoskeletal differential diagnosis using something called the inflammatory scale. And what we're going to do is we're going to break down an assessment of inflammation causing the joint pain into people that have a lot of inflammation, people that have a little bit of inflammation, and people that have no inflammation. So let's look at first people with a lot of inflammation, because often that's caused by autoimmune problems. And this is the most significant, dangerous problem causing aches and pains. It's very rare, but this is what the specialty of rheumatology is focused on. We're looking at joints that have swelling, loss of range of motion, loss of function, really severe problems with synovitis. So that's the first thing we're looking for, a lot of inflammation. Secondly, we're going to looking for presentations that have just a little bit of inflammation. Now, this is normal inflammation as opposed to abnormal autoimmune inflammation caused by damage. Now, this damage could be soft tissue, a strained muscle, tendinitis, bursitis, or it may be damage to the joint itself from cartilage loss and bone edema and pain from that. Inflammation is present, but it's not as intense or severe as in the abnormal autoimmune problems. Then we also have people who have a lot of aches and pains, but really no active inflammation. And this is usually neuropathic pain. And the neuropathic pain is often diffuse, multifocal. It can be caused by peripheral nerve problems or even sometimes autonomic nervous system dysfunction. Or sometimes it can be really problems with central pain processing, which is really hard to figure out sometimes. But we're going to look at these different phenotypes, the different presentations of musculoskeletal pain, by looking at how much inflammation is associated with them as a way to approach these problems. So let's look at breaking this down a little further. People with a lot of inflammation, with swelling, loss of range of motion, loss of function, can either have severe or moderate problems. What makes it tough is sometimes, especially if they're partially treated or have earlier mild disease, they might just have mild autoimmune disease. And that can look quite a bit like soft tissue pain or degenerative disease. And so these presentations can sometimes cross over. But that's okay. If we don't have a lot of inflammation, we can really treat this in the same way we do normal inflammation. And people that have no inflammation, you have to sort out whether it's a problem with the peripheral nervous system like we see in diabetics, or the autonomic nervous system with things like sympathetic dysfunction, and central nervous system problems like you see in fibromyalgia. The reason we need to break these things down is so we can have specific targeted therapy, and these inflammatory scale presentations will help us to do that. So when we have people with a lot of inflammation, you've got to suppress that immune system, because abnormal autoimmune synovitis or inflammation of any organ system can be not only severely symptomatic, but also organ-threatening and sometimes even life-threatening. And so you have to be aggressive, and this is where the world of biologic medicine has really made big headway. And so to use these expensive, more risky medicines, you need to know that you have synovitis. Whereas if people have milder inflammation, you can relax. You don't have to be as aggressive, and especially if they don't have any type of autoimmune disease, you can target soft tissue pain with more physical therapy approaches, and sometimes you can just do injections, and that's a great way to take care of local normal inflammation that isn't responding to physical medicine. And when it comes to neuropathic pain, it's a bit more difficult to treat because addressing neuropathic pain is less specific. You can use medications, things like gabapentin or Lyrica, but you need to get into lifestyle medicine to modulate nerve function, things like daily exercise, good nutrition, good sleep, and mood management, things that really affect neural function. And so these categories will help us to target our therapies. Let's now talk about the different phenotypes within these categories. So we're going to look at the presentation of severe inflammation, moderate inflammation, and no inflammation. So let's just talk about that for just a little bit. We'll look at these different presentations and see how you can sort them out in the clinic. So in more severe autoimmune inflammation, what you'll find is that there's going to be synovitis, especially in rheumatoid arthritis, in the hands, often in the knees. And what you're looking for in these types of presentations is synovial thickening. So you want to see, is the synovium itself swollen? You want to see if there is decreased range of motion of the affected joint that's not caused by damage. And you really want to look and see how is that affecting their function. Because when you have severe inflammation, you'll see synovial thickening, you'll see loss of range of motion and loss of function, and that's why you really need to be more aggressive. So when you're having more moderate inflammation, it might be that they're just having mild autoimmune disease, but that can be managed without a big change in immunosuppression. You might be able to do injection therapy. But if they're having mostly soft tissue pain, then you really want to use physical therapy as your starting point, because rehabilitative exercise is really the key. And so the phenotypes are going to be rotator cuff tendonitis. Most shoulder pain is rotator cuff tendonitis. You're going to see a lot of trochanteric bursitis, lateral hip pain. Almost all lateral hip pain is tendonitis. You might see anserin bursitis, or this might be where the osteoarthritis is starting. You'll see plantar fasciitis down here, epicondylitis here, and you also want to look for problems of tendonitis even in the hands. So what you're looking for is physical therapy, ways to address the soft tissue pain, which will also help osteoarthritis. But then you want to see, can I do injections to help with temporary relief while we're doing the physical medicine? When it comes down to neuropathic pain, the problem is that the pain is really more all over, diffuse pain, if you're talking about central pain. Of course, peripheral neuropathy often gives you this stocking glove, numbness and tingling. That's pretty straightforward. People don't have trouble with that. Sometimes autonomic nervous system problems will have problems with vasodilation or vasoconstriction, the most severe being CRPS or the old reflex sympathetic dystrophy. That's our approach. When you go in to see the patient, you'll listen to their problems and you'll try and start sorting through, is this a lot of inflammation? Is it a little bit of inflammation? Or is there really not any inflammation? And the harder part is you have to be a splitter. You have to look at the different kinds of pain and see, do they have different components of this that are going on and how much. So hopefully that'll be helpful to you to have an approach to start figuring out what's causing their pain and then having targeted treatment for that. Good luck.